Good morning. Today in this lecture, we are going to discuss about the relationship of a patient with the physiotherapist. So patient and physiotherapist relationship, we are going to see how does it looks like and what are the relationship between a physiotherapist and a patient has. So we are going to discuss in this lecture about the relationship, what a relationship possessed by the physiotherapist with their patients, how do they behave, how do they treat, in which way they communicate, what are the ethics, all the different types of things regarding the relationship between the physiotherapist and the patient we are going to discuss in this lecture. So let's begin with this. The objective of this lecture is to make you people aware or you people understand the basic concept behind the relationship between the physiotherapist and the patient. What relation do they have with their patients? How do they treat their patients? What should be the body language? What are the ethics? What are the practicing ethics? All these are included in this lecture. So there is a patient relationship program which exists, and it exists to enhance and promote the therapeutic relationship between the physiotherapist and the patients by providing them the education and the resources to assist both the groups. So this is very helpful program to build up a healthy relationship between the physiotherapist and the patient. So as you can see here, how the patient is helping in this picture is being assisted by the physiotherapist. The physiotherapist is advising them, supervising them during their exercises, and the patient relationship committee also ensures the services and training supports available. Also, they prevent the abuse of the patient. They have maintained some ethics, some guidelines regarding which we have to maintain, or we have to see what are the rights of the patient, what are the rights he has, and we should make sure that while we are practicing as a physiotherapist, we should not violate any law or any rights of the patient. We have to make sure that we are practicing very ethical way, in a very ethical way, and we should not violate any law. We have to do all the things which are guided by the society or the governed bodies. They have told us to do. So what physiotherapists basically do, this comes a big question, that what physiotherapists do basically. So physiotherapists treat the patient, physiotherapist assess the patient, physiotherapists prevent physical deformities and problems, and also rehabilitate the patient, decrease the pain of the patient. They restore the movement functions and improves the health status of a patient. So in short, if I say that physiotherapist makes the people to live their life in a better and healthy way, they provide them, guide them to live their life in a better and a healthy way. So physiotherapists are very important or integral part of the society and the healthcare system, because we are the main people who are doing the main job for the rehabilitation of the patient. So whenever you see a physiotherapist, you can expect they could be do the following things, such as they can carry on assessment during the condition, they can review and discuss the findings, they can develop a plan for your treatment, they will meet your needs, obtain the consent of for the treatment. So all these things a physiotherapist will do. A physiotherapist also regularly measures your progress and makes the report of it, then provide you advice, home programs, keep a record of your care, motivate you, and also help you to rehabilitate, to get a better life, a healthy life, to help you in the whole treatment period. So a physiotherapist play a very vital role. If we see for the assessment part, a physiotherapist has to do a whole assessment of the patient, examination, observation, investigation. Then he has to take the history of the patient, past history, present history of illness, each and every part of the assessment part will be noted down by the physiotherapist, and often usually involves touching. Some of the techniques that physiotherapists use are manual therapy, exercise therapy, and electrotherapy. These are the three big tools which a physiotherapist use during their treatment. So what is the importance of it? Let us say a physiotherapist will allow you privacy to change your clothes and provide you with a way to cover yourself in a necessary way. A physiotherapist also need to feel how many of your muscle body parts move, what is the proper range, what he has to work on, is the joint is stiff or not, is there any kind of redness, spasm. All the things are being assessed by the physiotherapist, and he has to do it by manual means. He has to touch you, he has to observe you, he has to see whether in which condition you are right now, and what could be the main treatment of plan could be there to improve your condition. Then the use of touch part, use the he also expose your part which is going to be treated. He can use the electrotherapy modalities like short wave diathermy, ultrasonic waves or ultrasound therapy, shock wave therapy, laser therapy. All these are helpful in decreasing the pain. Then the relationship between the physiotherapist and the patient is very important in the outcome of the treatment. If the bonding is very good, if you are friendly with your physiotherapist or the doctor, the outcome is very good. It is going to affect both the pain, disability, as well as your psychology. Psychologically, if you are strong, if you have the willpower, you can be get healed or get treated very easily. Performance and expectations. If we see the physiotherapist demonstrate the standards which should be like understanding the difference between a therapeutic relationship and a personal relationship with the patient, then the components that characterize the difference, that is power, trust, respect, personal closeness. So if there is a professional life and a personal life, so the physiotherapist or anyone should not relate or combine both the things, the personal and the professional life. So what we have seen the relationship between the physiotherapist and the patient, and we have seen different roles played by the physiotherapist. A physiotherapist should be a rehabilitation specialist also. He should rehabilitate the patient. He should be friendly also with the patient so that he will motivate the patient to perform. So the relationship between the physiotherapist and the patient should be will be a healthy relationship, should be a healthy relationship, and it has to take care that by the physiotherapist that you always motivate your patient instead of making him fearful of not being very well soon. Always motivate the patient, because if the patient has the willpower, he will try to get up, he will heal up very sooner. If he has the willpower, he will perform better. So it's a very difficult task and job of a physiotherapist to make his patient to do the exercises. When you will go in a practical field, you will see there are a lot of patients are there who deny to obey your commands and obey your scheduled exercises. If you told to them to do these exercises, these will be helpful, they will not understand you. There are so many people or patients are there. A physiotherapist has to behave or has to treat the patient according to their age and nature also. A physiotherapist should deal a pediatric patient in a very delicate manner, in a very childish manner. If I would say, if you are treating a patient who is a child, you have to be a child with him. You have to make him laugh. You have to give him toys or toffees or chocolates so that he will understand you. He will be friendly with you. Similarly, if you are treating a geriatric patient, an old age patient, what you have to do? You have to understand their psychology. You have to understand their denying nature. You have to understand that they are not going to do it very easily whatever you will say to them, because they have their own mindset. They, most of the geriatric patients have denied to do the exercises because it's difficult for them, and it's not likely very familiar to them to do these exercises. So it's become very difficult for a physiotherapist to make the patient understand that how to do correct posture exercises, correct method of exercises. So the relationship is very difficult. But if it is a healthy relationship, then the patient will heal up very sooner, and he will be satisfied also. His recovery will be very good, his prognosis will be very good, and psychologically he will feel better, to motivated to live their life. This is all about the relationship between the physiotherapist and the patient. So what we have discussed in this lecture is the relationship between the physiotherapist and the patient. We have discussed the program for the relationship building of the physiotherapist and the patient. What should be the relationship must be there. The relationship must be healthy. The physiotherapist should be very motivating, very helping, and the physiotherapist should always keep their personal and professional life in a different way, should not mix them. Do not do the favoritism to any of the patient. Treat each and every patient, and always remember, in any condition patient comes first. You cannot deny any of the patient to treat, do not to treat, because of any circumstances. You have to treat the patient whenever there is a requirement to treat the patient. So it should be noted and it should be done. So this is all the things we have discussed in this lecture.